I'd like to talk with you now about the part two of cognitive behavior therapy. We left off talking a little bit about Albert Ellis, who's probably considered to be the true pioneer of cognitive behavior therapy as it was known as cognitive behavior therapy. But it's also important to note that Alfred Adler was probably the grandfather. If we're going to call Albert Ellis the father of cognitive behavioral therapy, we need to give a lot of credit to the Neo-Freudian Alfred Adler, who did such a good job of blending psychoanalysis with um, kind of a new way of thinking about doing therapy, which shifted the uh, the emphasis to being more focused on what a person's intents were and what a person thought about doing in terms of goals, rather than subjecting oneself to the demands of unconscious processes and id impulses. So that was a big shift that Adler had made, and Albert Ellis himself acknowledges that heavy debt of gratitude to Alfred Adler. We're going to open with a little bit of a critique of Albert Ellis. Earlier, I had said that a lot of Ellis's assumptions about religion were pretty. I mean, they were controversial. I want my goal in talking to you about why Albert Ellis was critical of religion was to try to place him as much as possible in his context and understand that there were so many people, and this continues to this day as well, who tend to suffer a lot because of the pressures placed on them by the demands of religious faith. I think we can all empathize with people who maybe had grown up in a very strictly religious home and who had lots of expectations placed upon them, and who therefore, whenever they messed up or didn't measure up, if they were part of a faith that heavily punished or severely criticized mistakes or sins, a person could begin to feel pretty terribly about themselves. And as opposed to experiencing a lot of the love and happiness that's associated with religious faith for so many people, a lot of people can associate being part of a strict religious tradition with feelings of guilt and feelings of disappointing people. And so these are the kinds of people that Albert Ellis frequently saw. And so while on the one hand, we understand his criticism, and we can all empathize with criticism. On the other hand, it's important to point out that his criticisms of religiosity were really quite shallow and were not very philosophically sound. Um, my goal in offering this critique of Ellis is to help you understand as you work with clients, those of you who are going to become counselors. It will be important for you to understand how some of the assumptions of Albert Ellis could potentially clash with either your own values or with the values in some of the clients that you're going to be seeing. Albert Ellis was a part of a movement in psychology. It wasn't necessarily an intentional movement, but it was nevertheless a movement to secularize the field and to discourage people from using religion or their religious faith as either a crutch or as a guiding moral principle in their lives. Many of the psychologists of the 1950s, 60s, and 70s tried to encourage people to move away from religious faith and showed quite a bit of hostility towards the religious faith, inasmuch as they thought that religion was very repressive. And so this will certainly clash with some people who have a strong and robust faith and don't necessarily feel guilty about some of their wrongdoings, but feel like they worship a God who loves them and forgives them. And so it's important to point that out. But here are a couple of criticisms I'll offer of Ellis. First of all, is the idea of human-centeredness as being a kind of a drive or an instinct. Now remember, Ellis did not believe that people had a natural self-actualizing tendency. His faith in humanity was actually very low, but he did believe that people would be a heck of a lot better off if they would just drop all of these unhealthy pressures and expectations that prey upon people and cause them to feel miserable about themselves. Um, but he nevertheless said that despite the fact that he didn't have a lot of faith in humans, he nevertheless put all of the emphasis in his work on human centeredness. And this is when you do this, this becomes more than just a model of health, human-centeredness. This becomes a statement about about the primary drives of human beings. And so when you have a view of human flourishing that basically argues that people should live for themselves and in isolation from the influences of other people, you understand why he might argue that, but to argue that we should be so independent and to largely be skeptical of the communities that we came from and the families that we came from, you could see how that could really set up a lot of problems for a person, especially a person from a more collectivist society that places a huge value on group identity, and that and in which a person, when they are contributing to the good of that community, derives a great deal of meaningfulness and significance in their lives. Moreover, Albert Ellis was not an expert on human drives, so for him to talk about human-centeredness as a drive or as an instinct, it does not hold up very well when placed under the microscope of closer scrutiny and inspection. We also know that people are motivated in very nonlinear ways. For example, Christians are heavily motivated by sacrifice. Um, just because Albert Ellis was a hedonist and thought that the best thing we could do in life was to seek out pleasure and to seek out the good things in life, doesn't mean that seeking out the good things all the time is necessarily very rewarding. It might actually, for a lot of people, be very unhealthy for you. You might, for example, appreciate the courage that he showed in his experiment at the Bronx Zoo, in which he asked out hundreds of women and got a bunch of rejections. On the other hand, we also know that human beings are not meant to be alone, and that human beings flourish when they're with others, and human beings are at their very best when they show responsibility for their brothers and sisters and their fellow human beings. And so I think Ellis was a very good corrective for many of the things that had ailed so many people, but I think in a few ways he overstepped the need for human independence and the need to have people be in a place where they feel like they don't need anybody else. This is disingenuous, I believe. Also, his belief that hedonism is a rational way to live and that being religious is an irrational way to live it is a bit inconsistent. One could make the argument that living hedonistically is just as irrational as living religiously. He doesn't make a very strong case for why hedonism is either a morally superior or logically superior way to live. His belief that we should live hedonistically, I think, was more a reflection of his personal values rather than a prescription that should be given to all people. And that, to say nothing of what happens when one's hedonism interferes with, say, another person's freedom. What if the pursuit of pleasure causes you to exploit other people? What if your pursuit of pleasure shows you to be irresponsible to your own family, etc., etc.? So we want to now move over into the second major theorist. By the way, when talking about Albert Ellis, no discussion of Albert Ellis would be complete without a mentioning of his list of irrational beliefs. You can Google this very easily, and this is a very helpful list of items that Ellis listed. They're not really items, they're really, his list of irrational beliefs it's a list of statements that people often make that he believed were counterproductive and would often get people into a lot of trouble in terms of their mental health. So he would say things like one of the irrational beliefs is that everything needs to go well, and if things don't go well, that's an absolute disaster. Or everyone must like me at all times, and if someone doesn't like me, it's an absolute catastrophe. Or I must be happy in my work at all times, and if I'm not happy, then that's an absolute disaster. Or the world should be entirely just. There is one that he argues that an irrational belief is that I depend excessively on a higher power in order to provide me with the things that I need in this life. He would argue, of course, that that's irrational because the best way to go about getting the things that you want in life is to go and get it yourself. Again, the emphasis is on the empowerment of the individual. So Ellis, one more thing I will say to his advantage. He contributed heavily, heavily, heavily to the field of therapy and psychotherapy. His work benefited therapists, his work benefited clients, and he really helped people to step into themselves as people and try to accept themselves on their own terms. For this, he must be praised. If there was a Hall of Fame of great therapists, he would be a first ballot inductee. But there is a lot of criticism, I think, that's warranted of Ellis's approach that I tried to do a job of mentioning here. So now moving on to Aaron Beck. Aaron Beck is probably just behind Albert Ellis, the most famous of all cognitive behavioral therapists. And Aaron Beck's work was groundbreaking in that it was extremely data-driven. Beck spent a huge portion of his life actually studying people who were clinically depressed and what made them clinically depressed. And his research findings really led to the development of an entirely new theoretical orientation. Slightly different from Albert Ellis's, but certainly similar enough to where he's included in the same category of cognitive behavioral theorists. First, he noticed that when he talked to hundreds and hundreds of depressed patients, he noticed that depressed patients had cognitive distortions regarding how they interpret their experiences. Meaning, when people talk about themselves and talk about their days and talk about their lives, that they have highly distorted thinking. They engage, for example, in abstractions, generalizations, and exaggerations. For example, depressed people don't say things like, every once in a while I make mistakes. Depressed people say, I'm a complete loser. Or someone might say, a relatively healthy person might say, I really don't know very much about what I'm going to do in the future. The future is unknown to me, and I don't seem to have a plan. But a depressed person will say, I will never amount to anything. Like whatever it is that I'll try, I'm going to fail at. Whatever it is that could be out there that could be good for me, I'll find a way to screw it up. Or maybe someone would say, who's not depressed, kind of relatively normal, would say, I just met somebody and I'm potentially romantically interested in them, and I hope that it begins to work out. And it's a little scary at first, but I really hope that our relationship could work out. But a depressed person in that same situation would say things like, I'm unlovable. They're going to find something wrong with me. I'll find a way to screw this up. I always do. And so he just noticed in talking to hundreds and hundreds of depressed patients that they were distorted in their thinking. Their thinking was off. And this really stood out to him because this is really different than the kind of stuff Sigmund Freud was talking about. Freud would say things like, if you're depressed, it's usually because you've lost something. This was very different. This had nothing to do with whether or not a person lost something. This was just the way they thought. It was something that he noticed. He talked to hundreds and hundreds of depressed people, and he found that they all had this one thing in common. They had very distorted thinking. Their thinking was flawed. Their thinking was off. And anybody who was in the same room with them would hear them speak and hear them say these things, and they could easily identify it. They would say, man, this person really is way too hard on themselves. Like, I know they're down, but my goodness, they're really hard on themselves. So these things that he was noticing were easily detected by other people. But the most important thing is that these people who were depressed provided zero evidence whatsoever that they were right in their appraisals. So the person who would say, I'm a complete loser, well, there's no evidence for that. There's zero evidence for that. In fact, if you look at their lives would actually suggest the opposite. Now, this puts the therapist in a very interesting spot because on the one hand, as the therapist, if someone says, I'm a loser, if you do it Carl Rogers style, you're going to listen to them and say, okay, so you feel like a loser, let's talk about that, and do this in this very gentle, approving, understanding, nodding kind of way. But if you're someone like Albert Ellis and you're very aggressive, you might say, there's absolutely no evidence in the world for you to say that you're a complete loser. Stop feeling sorry for yourself. Pull up your pants and go to work. Or get back in there and keep pitching. Because, if you were to respond to it from the evidence perspective, there's zero evidence for this. Or the person who says, I will never amount to anything. Well, how do you know that? You have no idea if that's true. You could amount to something beyond your wildest dreams. So depending on the kind of therapeutic style you have, either a more confrontational style or something that's a little bit more reflective and understanding and empathetic, you could respond to these statements either way. For Aaron Beck, this was just something that he noticed about depressed people. Depressed people would engage in these cognitive distortions without any evidence for it. He also identified something called automatic thoughts. Automatic thoughts are the immediate catastrophizing thoughts triggered by events that may or may not be related to the thoughts. So, for example, the example I always use is, suppose there's a student who gets a bad grade on a test, and if they get an F on an English exam, the automatic thought that people will get is, "I'm a loser, I'm no good," and so they go from 0 to 100 in 1 second. An automatic thought enters their head that something is not quite right, and they cling to this thought, even though getting a bad grade on a test is a one-time event or a two-time event. It could even be a 20-time event, but it doesn't mean you're a loser. And that's another it's an example of a distorted way of thinking. Depressed patients react to situations with a very simplistic, very negative, and very biased conclusion about themselves. I'm no good. I'm an idiot. I'm ugly. I'll never amount to anything. These kinds of things. When a person is locked into being in a depressed state, they stay very much strongly in that place. And so these automatic thoughts and these distortions revealed what Beck called a schema. A schema is like a way of looking at the world through a special set of lenses. It's a preset model that's used to help us make sense of information. And you could have a positive schema or a negative schema. So a positive schema would be a way of framing your experiences and framing your understanding of the world in a way that makes sense to you. And of course, depressed people have really, really negative schemas. So other cognitive distortions that Beck was able to identify in depressed people were arbitrary inferences. Arbitrary inferences are basically generalizations when one makes a conclusion without having any evidence. How about this? A bride says, "My wedding was a disaster because the photographer was late." No, your wedding was absolutely beautiful and fantastic. The photographer was a few minutes late, but everything worked out just fine, and you were 10 or 15 minutes late. No problem, stop complaining. Or, again, getting back to Albert Ellis, if everything isn't always perfect every single time, then this is an absolute nightmare. Some people really take advantage of this situation and complain and want to be the center of attention and play the victim card. And these therapists said this is really hurtful to a person. When a person plays the victim card when they haven't really been victimized all that much, in the long run, the person they hurt more than anybody else is themselves. Another example of a cognitive distortion is a selective abstraction. This is when you form a broad conclusion based on an isolated detail or an event. For example, a person who only looks at his or her flaws and ignores their many, many strengths. You might encounter someone who says, "Well, this person hates my guts. This person can't stand me. This person just thinks I'm the worst person in the entire world." But it's only one person in a sea of people who just love you very much. But what does the depressed person do? The depressed person focuses on that one person who doesn't like them, and that becomes the disaster story or narrative for their lives. Another distortion is the overgeneralization. This is when you apply an extreme belief to a totally dissimilar set of circumstances. A classic example would be here like all people, and you can insert like whatever race you want to. All people from a certain country, or all people who have a certain skin color, or all people who are of a particular religious faith are no good. And they're basing that not on the fact that they know every single person of that race, but on one or two bad incidents that they could have associated with a member of that race or a member of that ethnic group or a member of that religion. So it's an overgeneralization. Another example is a magnification or a minimization, which is when you dwell too much on a detail and you overlook the benefits. How about this? Yes, I won the award, but my competition was weak. Or yes, I was given a raise, but it was 5 years too late. So you're dwelling way too much on an insignificant detail, and you're overlooking the real benefit that's coming to you. Another example is personalization. This is when you blame yourself for external events that you're not fully responsible for. A person might say, "It's my fault that our city is filled with pollution." Well, maybe you've polluted a couple of times, but is it really your fault that the entire city is polluted and it's all on you? But what did Beck find? He found that depressed people tend to do this. Depressed people tend to blame themselves or feel badly about themselves for things that are way beyond their control that they never would have been responsible for. Other distortions include labeling or mislabeling. This is when you base your identity on an isolated previous event. How about this? We may have seen this from a movie. I failed to catch the touchdown pass in the championship game. Therefore, I'm someone who chokes under pressure. Therefore, this is the most important thing in my entire life. Therefore, I will never amount to anything. So this is when you label some part of yourself from the past as being less than perfect, and it continues to dominate your life. Another example is polarized thinking. This is when you hold an extreme position or belief in a kind of black and white, all or nothing kind of way. How about this one? Unless that boy loves me, then nobody loves me, a young woman might say. Unless I get into this college, then I should never go to college at all. If I don't get an A on this paper, then I might as well just fail the course. If our team doesn't beat this team, then we might as well cancel the whole season. So this is all or nothing thinking, and depressed people do a lot of it. Beck's approach is that he would often be way less confrontational with people than Albert Ellis was. He was much more relational, personal, interactive. He valued things that were also very important to someone like Carl Rogers, like clarifying feelings, challenging clients to act, encouraging them to consider the seriousness of their self-criticism. He was a little more direct than Carl Rogers. Carl Rogers was pretty much non-evaluative, but humor, taking on the role of the depressed client to reveal the severity of the symptoms, establishing clear goals and a plan of action. Some of these things were similar to what other therapists of the 50s, 60s, and 70s were doing. Aaron Beck invented something called the cognitive triad, and it's kind of similar to what Albert Ellis did with his ABC model. The cognitive triad of depression is that clients hold a very negative view of themselves, which results in inadequacy. Second, clients interpret their environments and their experiences negatively. And third, depressed clients view their futures very bleakly. You could summarize all three of these feelings into one statement, and here's that statement. This is the kind of the statement of the depressed person. I'm no good, the world is no good and unkind to me, and my situation is hopeless and I'll never amount to anything. These are kind of the big three themes that you see in clinical depression according to Aaron Beck. He called it the cognitive triad, and notice that all of them have to do with thoughts and your perceptions, how you think about the situation, not what you're doing about the situation. So that's Aaron Beck. We're heavily indebted to Aaron Beck, not only for his work with depression, but his work with clients who are anxious and being able to help us identify what causes, or at least what's associated with clinical depression. He was the author of two very famous tests that are still in use, the Beck Depression Inventory and the Beck Anxiety Inventory. He also has one called the Beck Hopelessness Scale, which are now standards of clinical treatment for clinical psychologists. We now turn our attention to Donald Meichenbaum. He's the less known of the three that we've talked about so far, but he nevertheless proposed a form of therapy called cognitive behavioral modification. And what he found is kind of similar to Aaron Beck and his concept of automatic thoughts, but Meichenbaum found that self-talk or self-statements were things that became as hurtful as criticism from others was. So people are often very hard on themselves in terms of their self-talk. And so the goal that he developed with people was to help people interrupt these statements and understand how dangerous and how consequential they can be. Another goal was to actually help them get better through something called self-instructional training, SIT, which is a way of trying to restructure how you think in order to change how you behave. For self-instruction training, SIT, there was phase one, which was self-observation. So he would have patients listen to themselves and just listen to their own statements, listen to themselves talk. And hopefully, over time, he would help people realize that we aren't just victims that are passing through life without doing anything, unable to do anything about anything. But we ourselves are largely contributors to our problems. The result is that this will help us view our problems in a new light. If you suddenly become aware of the fact that you are the one who is primarily keeping yourself stuck, it will result in you behaving different and doing something different with your day tomorrow. He would say something like, you have the power to change your life today, and you can start today. And you will be way better off doing that than sitting here and being angry at this world, and angry at your parents for being born, and angry at the people for disappointing you, and angry at people for disappointing you at school or at work or on the athletics teams. You have the power to change who you are today. Do it. Phase 2 is starting a new internal dialogue. This is when a person begins to gain a more accurate understanding of the situation and to be kinder to yourself and nicer to others. This change in thought leads to new behaviors. That's kind of like a fundamental of cognitive behavioral therapy in general. Phase 3 is learning new skills, so coping skills, learning some new internal sentences, learning to say something to yourself when you feel yourself being too hard on yourself. And then another part of this is stress inoculation training. Stress inoculation training may be Donald Meichenbaum's most significant therapeutic technique, and we'll talk about that in subsequent slides here in just a moment. The presumed result of going through SIT training is that other people will act differently once you learn these new skills, which then further confirms the fact that you have made improvements yourself and you've done something to make it okay. So the more you try on these new behaviors, these new ways of doing things, the more other people will start to confirm these behaviors and encourage you, and it validates the changes that you've made. So the most famous of Donald Meichenbaum's coping skills for anxiety and depression was something called stress inoculation training. So what Meichenbaum would do is he would expose patients to minor stressors in order to prepare them for major stressors. So what he would do is he would start out in phases. He would say at the conceptual stage that a client would receive cognitive therapy. Then you would teach them different skills and help them rehearse these skills, such as developing coping skills or a plan for alternative courses of action, relaxation training, changing a person's attitude to one of health and well-being, and then applying this and following through. You put these skills into action. And so he would ask patients to kind of rehearse a situation that they felt was anxiety-provoking and walk them through it and have them experience a little bit of that anxiety, but he would also equip them for how to cope with it so that when the real stressor comes and there's a lot of anxiety, you have a script for what to do and how to act. And like a regular inoculation that you can get from a doctor, you've already become exposed to it a little bit, and so you know how to defeat it better than receiving it all at once. You also go through something called a constructivist narrative perspective, which is a combination of narrative therapy with cognitive behavior therapy. So a quick word about narrative therapy, which is a lesser-known form of therapy but has been getting more exposure here in recent years. Narrative therapy is when a patient and a therapist go through the therapeutic process by constructing a story of the patient's life and learning to see that the problems you've experienced are just part of the first few chapters of your life. And as you get older, it's kind of like when you're reading a book and the first few chapters might introduce a problem to the central character. You, as a depressed patient or as an anxious patient, are someone who's kind of telling a story. And the part in your life where you are depressed or feeling lost or bewildered, well, that's kind of like the first few chapters of your story. And the question that the narrative therapist asks is, how is this story going to end? We're at this great point when, in the story of your life where you're going through a difficult time, and this is where you can be challenged. This is where you can grow. This is where you can be stretched. Is this how your story is going to end? And so how we tell our stories reveals so much about ourselves. Listen to a depressed person tell the story. It's usually a very sad and passive and helpless story. How does an anxious person tell the story? It's usually very frightening, and et cetera, et cetera. So that's what Meichenbaum contributed, and hopefully that's very helpful. We'll continue to talk about this next week in lecture.